So hello everyone. Today I am Dr. Ann Thomas, consultant oncopathologist of MVR CCRI, and today we have with us Dr. Prashant Tembhare. Sir is a professor of Tata Memorial Hospital, Mumbai, and an expert in the field of flow cytometry and an expert in hematopathology. So welcome, sir.
Thank you. Ann.
So we have come here to discuss about the diagnostic tests that are usually done in blood cancer. So before going into these diagnosis tests, I think we'll start with a simple question of what is a blood cancer, sir?
So, blood cancer is any type of cancer, but it present in the blood. It arises from the blood and blood cells. So there are two types of blood cancer. One, the cancer which arises in the peripheral blood or bone marrow of a patient. The other one is called as a nodal cancer or lymphoma, which arises from the lymph node of a person. So this is a cancer of basically immune cells which play important role in the immunity of a person.
Okay, so basically the uncontrolled proliferation of the blood cells, either from a lymph node or a peripheral blood, will result in a blood cancer.
Yeah.
So sir, so what are the tests that we usually use for diagnosis of blood cancer?
See, blood cancer, like any other disease, we have to do a lot of laboratory tests to confirm the diagnosis. So we do microscopy examination of patient's blood or lymph node biopsy, and then we look at once we do the microscopic examination, we do the spatial staining to identify abnormal versus normal cells or cancer cells. Then we do flow cytometric immunophenotyping or immunophenotyping by immunohistochemistry on lymph node or bone marrow biopsy. And then other than that, we also do the genetic testing by using cytogenetic, FISH or molecular testing to identify this cancer, to subclassify, that is subtyping of this cancer, and then also to look at whether this cancer is of relatively good nature or very bad disease, what kind of treatment can be given, what are the different targets to give the novel kind of targeted therapy. So these are the different tests. So to summarize, we do microscopy examination, we do flow cytometric immunophenotyping as well as immunophenotyping by immunohistochemistry. Then we do cytogenetic and we do molecular testing.
So I think, sir, first we can actually suspect a blood cancer by mere CBC when the count is very high. And then the clinician go for a peripheral smear examination on bone marrow. And most of the time with the peripheral smear or bone marrow examination, pathologists can actually give a diagnosis of a leukemia in most of the cases. But then sometimes, every time the clinician asks for another special test of flow cytometry, which is a very more expensive test. So once a diagnosis of leukemia is got from a peripheral smear or a bone marrow examination, then why go for this expensive test of flow cytometry leukemia, which you are an expert of?
I think this is very important question, and you have asked very rightly. When you can diagnose something by peripheral blood or bone marrow, just plain microscopic or peripheral smear examination, why to do the expensive test? Now we have to know that we can go from one place to another place by just walking, or by just or in a small vehicle, but we still need for long distances or to go quickly to particular distance, we use plane or the buses and car. The same way, this is also one of the kind of tests. So what we do, we look at on peripheral smear and blood on morphological examination, we can identify leukemia grossly, that there is a disease we suspect, but we don't know which type of that. There are multiple types of blood cancer. Blood cancer is not a single cancer. There are multiple types, and their treatment also different. The different type of blood cancer, the different treatment is different, and the cost of this treatment also varies. So when you want to give an expensive treatment that which costs at least 2 to 3 lakh rupees, then it is very important to choose the right treatment, so that you do not waste all these 2-3 lakhs or so much money in treating a wrong case. So for correct diagnosis, it's very important to do the flow cytometric immunophenotyping or immunophenotyping by immunohistochemistry, so that you know that you are treating the right type of cancer with the right type of treatment. So it is for the correct treatment and correct. It is important to do flow cytometric immunophenotyping.
So most of the cases by a peripheral smear or bone marrow, we'll just be able to say that it is just a leukemia. but we won't be able to classify whether it is a myeloid or
Yes,
a
we cannot
lymphoid.
subtype, yeah.
So because the treatment is based on the subcategorization.
Right.
So flow cytometry will help us in subcategorization of what kind of leukemia and treating the patient accordingly.
Yes.
So that is for diagnosis. Is there any other role for flow cytometry other than diagnosing a leukemia?
So as I mentioned, only diagnosis is not enough for any patients to treat. We want to know how this patient is going to behave, whether when the patient is given a treatment, what type of outcome will be there. The patient will survive, how long the patient will survive with the given treatment, so that the patient's relatives can decide whether give the treatment, how much treatment should be given, where to give this treatment. So for that, it is important to know what kind of disease is this, and which is called as a prognostication or the risk stratification of the disease. For that, flow cytometry is also important. So for risk stratification, there are so many markers or so different proteins we study on the cancer cells, which can tell you whether this is bad cancer or this is relatively better cancer and can be nearly cured by giving the adequate treatment. Then that is one thing. Then also we can look at what kind of response the patient has received. So once the patient has given treatment, whether that treatment killed all cancer cells or there are some cancer cells still there which can again grow back as a new cancer or can come back as the old cancer. So we want to know that also. So it also helps. Flow cytometry is a very sensitive technique which helps you to identify a very small number of cancers which are surviving in the patient irrespective of or despite of given treatment, and that helps the clinician or the doctor to decide or plan the further treatment. So not only the prognostication, risk stratification, but it also important for the monitoring of the treatment response of the given treatment.
Thank you, sir, for being here and sharing your insights on the uses of flow cytometry in the diagnosis of acute leukemia. Thank you, sir.
Thank you for having me here. Thank you.